It is important after orthopedic surgery that you have somebody at home to help you during that initial first 24 hours. The reason being is that they can help guide you, and if you have any issues or concerns, they can communicate it forward and also be that support person for you.
We have them being cautious to avoid falls, to making sure they don't take on any risky activities. If they have someone who can stay with them for a couple of days, that's convenient and nice, but it's certainly not a medical necessity. We don't send people home unless we feel like they can manage all by themselves.
You should also ensure that your home is safe from fall precautions. When other visitors may come to visit you, that they maintain distance as well as hand hygiene. You really want to ensure that you look at your dressing, that it's not with drainage on it. You would look for redness, any swelling, as well as checking your temperature, and communicate that back to your surgeon's office.
We aid patients' recovery by providing them with 2 or 3 different pain medicines and analgesics which work synergistically, usually trying to minimize the amount of narcotics that they require. Very often these days, hip replacement patients don't require any narcotic medication at all. And the other thing that we do is we make available to them a visiting physical therapist. The physical therapist typically provide the patient with a set of exercises that the patient can do when the physical therapist is not there. They'll typically walk with them, maybe take them outside to navigate sidewalks and paths around their home to make them feel more comfortable that they can do it if they absolutely need to. If you don't feel that you have enough information, I would suggest you address that directly to your surgeon and their team.